Okay, so this right here is the last thing we talked about. This is a lung abscess, and obviously this is on autopsy. So this is a real short video, so we're going to look at it real quick.
Necrosis of pulmonary tissue and formation of cavities that are more than 2 centimeters in size, and they contain necrotic debris or fluid caused by microbial infection. So basically, in lung abscess, you would see localized collection of pus within the parenchyma. What are all the causes of lung abscess? Lung abscess can occur due to bronchial obstruction, which happens in cancer, and as we mentioned earlier in this chapter, the squamous cell carcinoma of the lung will lead to cavitation, so you would see lung abscess of that. Also, lung abscess can form after aspiration of oropharyngeal content, because you would get some sort of infection with the oropharyngeal content. So this happens especially in patients that are predisposed to loss of consciousness, such as alcoholics and epileptics, and they would aspirate oropharyngeal content, and this will lead to infection causing lung abscess. What are some microbial organisms that will cause lung abscess? Lung abscess often occurs due to Staph aureus or anaerobes such as Bacteroides, Fusobacterium, and Peptostreptococcus. Name the drug of choice to treat lung abscess if it's caused by anaerobes. If lung abscess is caused by anaerobes, you can treat it with clindamycin.
For more information on this topic, click on the link in the description section below.
Okay, so just wanted to show you a picture of the autopsy, and any questions? I'm not gonna, I believe I did not hold you responsible for a let me make sure. I don't think I held you responsible for a specific anaerobic bacteria, just knowing that the anaerobic bacteria are most commonly the cause of the lung abscess. Just to make sure, what does anaerobic mean? Without oxygen. They don't need oxygen to survive. Okay, I'm going to look at tuberculosis first because it's next in the book. I think I say that, it may not be.
It is.
Okay. So tell me what you know about tuberculosis.
It's airborne.
Okay?
I think it turns a color under the a gram stain. I think, is it red or
Okay,
purple?
it's not a gram positive or gram negative. It's actually an acid-fast bacteria. So it stains red because that's what acid-fast bacteria stain. Now, staining is good, but there's several other mycobacterium that also stain red that do not cause tuberculosis. There's the Mycobacterium avium and another one. So if an acid fast is performed, they're going to want to grow the organism to see that it truly is Mycobacterium tuberculosis. Chest x-ray may help. Skin test. So these are some rods that have stained red under an acid fast. These are Mycobacterium tuberculosis. Now, one of the things that happens when we inhale the organism, depending on our immune system, depending on how many organisms are actually inhaled, the body tries to fight off the infection. And sometimes it does a fine job at it, and sometimes there's enough bacteria that some stay behind, and Mycobacterium tuberculosis likes oxygen. So it tends to stay in the areas that are most oxygen enriched in the apices of the lungs. And so the body will actually form a cavity around those bacteria that were not destroyed. And it's called a tubercle. Tubercle. So we get that little tubercle up there, and then we have the casing that forms around it, and it kind of, the body seals off. Now at any time, this bacteria could become active again if the tubercle, and I have a hard time with that word, if it ruptures and the bacilli are able to get back out. So in this case right here, we actually have progression of the tuberculosis and severe lung destruction caused by the tuberculosis. Does anybody know what they used to call patients who had tuberculosis back in the 1800s, early 1900s?
Consumption.
They called it consumption. And they called it consumption because it literally consumed the body tissues and muscles and everything else. And they, there just was not the cure that we have today. And they used to put these patients in sanitariums, and they'd have all the patients with tuberculosis would be in the sanitarium so that it wouldn't spread out. So another thing that happens is these con areas form, and that's when you have these tubercles that are in the lung, or there may be even one, and then when that tubercle starts to invade the lymph nodes, then they call it a con complex, G-H-O-N complex. So I would know that.
That's when it affects the lymph nodes?
Mm-hmm. And let's just take a look real quick at page 274. Mary, can I get you to read that? It's not a full sentence. It starts with a tubercle up on the left-hand side. 274. Yeah.
Tubercle or granuloma. In essence, it's tubercles. How do you say it? Tubercles.
Tubercles. I wanted to put an R there and it's not there.
Tubercles work to encapsulate or trap the TB bacilli in a nutshell like structure. Although the initial lung lesions may be difficult to identify on a chest radiograph, the lesions may be seen as small, sharply defined
Cassidy's.
When detected on a chest radiograph, these initial lung lesions are called gone nodules. As the disease progresses, the combination of tuberoses and the involvement of the lymph nodes in the hilar region is known as gone complex.
Okay. So initially, when those tubercles are very small, they don't show up on the chest X-ray, but the point that they do, that they get big enough to show up, then we actually call them a con. When the lymph node becomes affected, then it's complex. Okay? So the thing to keep in mind is that when the patient initially gets tuberculosis, they may have a full-blown infection, or the body may seal off these bacilli for infection at a later date. As long as they're sealed off, the bacilli will not be they won't be able to you won't be able to spread it. It's contained. But when you have your PPD performed, it will come back positive because your body has made antibodies to that. And now you're going to get a little inflammation where the body has tried to defend against the bacilli. Now, if the patient coughs up any mucus and they were to do an acid fast, they're not going to find any. If they were to try to culture, they're not going to find any Mycobacterium tuberculosis because they're encapsulated in this shell. But that shell has the potential to bust open. And if it does, that's when they get the secondary or post-primary infection. The patient usually will get infected at that point. Okay? So this is also showing a con complex right there. And tuberculosis is not just a lung infection. It can get anywhere in the body. Typically, though, the Mycobacterium tuberculosis, they like to get to oxygen-enriched places in the body. So your book shows the brain as being a place for the bacilli to get, bones, also the intestines. So when tuberculosis spreads throughout the body, it's called miliary tuberculosis. MIL